We have seen so many times insurances say it's the exact same. It's not.
You have everything with you, but you will receive prior authorization response asking for other things.
Some insurances, they'll actually hold all their claims maybe the first 3 weeks in January. Welcome to a new and enlightening episode of the Offsite Team podcast with my good friend April. How are you today, April?
I'm good. I've been busy December. How are you?
You've been busy. You just told me you had a self-care weekend, and for one of those that you said, I said, well, what does that look like for you? And for you, it looks like, hey, getting your hair done, getting your nails done. That's a lot of what most women do in the United States as well, too. So it just shows how close and how similar we all are together. But hey, today as we embrace the new year, we're recording this in December. We know it's going to drop a little bit later. As we embrace the new year, one of the key areas for business, especially those in the healthcare sector, is navigating the ever-evolving landscape of working with insurance companies. What does it look like from 2023 to 2024? This topic often seems like it's complex, it's challenging, but it is absolutely essential for the smooth operation and financial health of your DME, rehab, respiratory business going forward. So here's why this matters. The beginning of the new year often brings about changes in insurance policies, coverage plans, reimbursement rates, you name it. We need to stay abreast of these challenges because it's vital for ensuring compliance, optimizing revenues, and providing uninterrupted services to our clients and customers. So today, April and I, we're going to get into kind of understanding the intricacies of working with various insurance programs that can make a significant difference in how we effectively manage claims, handle patient billing, and maintain a steady cash flow. So today in this episode, we're going to break down the essentials of working with insurance companies in the new year. We'll cover their importance of staying updated with policy changes, how to effectively process claims, and ways to navigate the complexities of insurance reimbursements. Additionally, we'll discuss the impact of these insurance changes on your business operation, and how, essentially how we serve our clients. So we'll also dive into the role of offsite team members, how they can help your business, because a lot of these changes that have happened, we are not going to know until we start looking at remittances. And we'll talk about that in a little bit. So these professionals can be a valuable asset in managing the insurance-related aspects of your business, from staying on top of policy updates, handling claims, changing credit cards on file, you name it. Offsite team members can help with their expertise and support as we navigate these waters smoothly. So, hey, whether you're a seasoned professional going into year 20 managing your DME, or this is your very first year with the intricacies of insurance work and looking at the field, what does it look like in the new year? So, hey, April, when we talk about a new year and new insurance policies, what do you think about?
Well, first and foremost, deductible.
Absolutely. Deductibles always go up every single year.
And then new policies apply.
And so, a lot of, let's just start with easy Medi plan, or, a lot of people will have Medicare and then like a supplemental, like an AARP or a plan like that. And typically some of these plans will cover deductibles and some will not. What gets really crazy is, let's say last year, the secondary did cover the deductible, but this year they don't. That has happened a number of times over the years. So what do we do in those instances?
Well, in that case, first and foremost is that the offsite teams that we have are educated of how the policy rules will apply. We run eligibility, so offsite team knows how to run eligibility. Plus, they know how to educate the patient or the customer in terms of their policy. So I think that's very important when the offsite team knows what they're doing, because they can present it properly, and they would understand what it means, like changing the insurance. Like previously this happened, and right now this is happening.
And one of the things, we just don't say, hey, the offsite team is going to call your patients and say, hey, we need your money because you have a deductible. We train our team, and this is whether you use us or not. We train our team. We're going to call with empathy and say, hey, April, I need to let you know unfortunately, your deductible is not covered by your secondary insurance this year. I can understand how that can be frustrating for you, but it is this year. The deductible is, what's the deductible this year for Medicare? Is it like $350, $150? What is it?
$240 for 2024. That would be their new deductible.
Yep, okay, I missed it both times. So we'll say, hey, April, your deductible this year is $240. Would you like to put that on a Visa or a MasterCard? And so they're ready to process those claims for our patients. And, it's one of those things. It's as simple as, can we have your credit card so we can get everything moving forward? Now, sometimes they might say, no, I need to verify it. Okay, well, we just called them as well too. The number is 1-800, AARP or whatever it happens to be. We will then do that, and then we'll follow up in a few hours and say, hey, did you call them? And yes, they told us the exact same thing we just told you, and we're nice about it. We're not a jerk, but something as simple as deductibles and what that looks like. We need to be aware every new year going forward. So one of the things, most insurance plans don't change year to year, but there are a lot of little things that I have noticed every year that do change. And number one of them is prior authorizations. Sometimes they get harder. Sometimes they actually get easier every single year. Tell me what you've noticed with prior authorizations now that you've been in this industry 5, 6, 7 years.
Well, it changes. The last update that we have when you guys attended the conference is that for like medical advantage plan, they will now be following Medicare rules. So it would be easier, because before it was really hard to submit prior authorization to them. It's driving us nuts. Like when you're working on documentation, submitting prior authorization, you have everything with you, but then again, you will receive a prior authorization response from them asking for other things, or worse, you'll get denial right away.
Absolutely. No, it can go both ways, though. There is a insurance that is a Med Advantage plan, and it's the most amazing thing. We are a high-end rehab company, but certain Med Advantage plans, they'll actually lessen the requirements. So a couple of years ago, we were doing a group 3 wheelchair for a patient. Typically, that requires a lot of prior authorizations, you name it. This one third-party plan, all they ask for is a signed form from the ATP verifying that they do need this equipment, a signed order from the doctor, and it's covered. And I couldn't believe it. I'm like, it cannot be that easy. No PT, no, this is not the Med Advantage. This is just a standard third-party plan.
Right.
And sometimes when we see this plan come across, we're thrilled because the policies are so much easier. This does not happen frequently. If you call me, I'll tell you what insurance it is, and I'm going to tell you what insurance it is, and you'll be like, I had no idea. That's the one nice thing about working with us. We can tell you, hey, with this insurance company, it is so easy to get group 3, group 2 wheelchairs covered because that is all they ask for. Now, I'm sure it'll change someday, but as of today, that's what it is. So next thing I want to bring, every new year, we need to be looking at remittances like a hawk, an absolute hawk. Now, why? Why is that the case? Why should we be looking at our remittances inside and out, especially for claims submitted January 1st or later?
It's because during those months that there is a new deductible that has to be met. So a lot of times we thought that the deductible has been met because it was December, and then come January, it's like a surprise. You have a new deductible that has to be met.
Well, and on top of that, I would love to say everyone calls us and say, you know what, we went from Regents to Primera to Molina to Community Health Plan of Washington. They don't call us. And a lot of times patients will switch from one plan to another. Now, we are running eligibility in Brightree. So if you're not doing this in Brightree, it is something, it just needs to become habit. But we won't find that out until you run the claim and it comes back. Well, I know John's CPAP machine was paid the first 7 months, but the 8th month, it comes back denied. And then this is the beauty of the offsite team. We're not, we're going to call John on the phone and say, hey, John, I noticed your claim came back denied this month. And he'll wait. Oh, I'm so sorry. I forgot to tell you. It is now with Aetna or Cigna or you name it. And it's sometimes as simple as we just need to refile the claim, but we need to stay on top of those claims ASAP. Now, the claims that are harder, sometimes we'll have all these claims going through just fine, and then they'll make the requirements for the claim harder. And that might, even though they might have the same insurance, it will come back denied because now they're having harder requirements needed to cover claims. And this is why you need to have the insurance just be looking at the remittances because things can change. Do you have anything that pops to your mind when you think of that?
The address as well. We want to make sure that the address is updated.
Address can change.
Yes, that can change too. And if there's any update, we have to inform our offsite team about it, because there can be updates just like requirements on medical documents.
Yeah. And we're always talking. And it's really neat. We've had a number of times where one offsite team member will figure one thing out and then lets the rest of us know. And it can sometimes be in the amount of, thousands, if not tens of thousands of dollars, that it benefits us in our favor by learning one new item. For example, now we are in Washington State, and this only applies to Washington State. We have this weird sales tax. Like we have to back out sales tax in our state. It's really, really messed up. But also in the state of Washington, even though we have to back out sales tax, certain insurances also cover sales tax. So there's a different HCPC code that is, that will be paid for this. So it's one of those things. If you're in Washington State and you don't know this, just call me. We'll walk you through how that works, because it is a lot of money if you are not billing the right HCPC code for sales tax in Washington State. But likewise, in our state, there are other forms that you need to know. Hey, if I have this sign, I can waive sales tax. So for example, in our state, if it's a rehab item, we don't have to collect sales tax on that or back it out. And so if you're not, so I'm speaking to those in Washington State right now, but whether you're Texas or Kansas or New York, this is the vital part about being part of your local association. Because if you're part of your local association, they're going to tell you what these new things coming down the pipe are. Now, if you don't know who's your association, just call VGM and they'll set you up with your contacts so you can join your association, kind of figure out what those are every single year as things change. So one of the neat new things, since we're talking rehab, is the seat elevate feature is now covered on power chairs. So in the old days, seat elevate features were never truly covered on power wheelchairs. Occasionally we could get like a VA to cover the mechanism, but it is now covered across almost all insurances. So this is something you need to be aware of. Hey, if I'm doing a group 2, group 3 wheelchair, as long as we have the proper documentation on file, you can't just bill it, but it needs to be on the DPD and all of that. That is now covered as well. We don't get a lot of money for it, but $500, $800, $900, $1,200, that makes a big difference. And plus, your patient is going to be so much happier now. You hit a button, zoop, up you go. And it's easier to reach those, glasses in the cabinet or speak eye to eye with someone, depending on what seat elevate feature you have. So that's one of those new things. In 2024, the seat elevate feature has changed. And we know that because we're on the email list and we're tied into VGM, and they say, hey, this is now covered, or US Rehab. What else do you have, April, that we're going to need to pay attention to in the new year?
I'd say the TPE audits.
Oh, you just said a bad word. TPE audits. Now, first, for those that don't know, God bless you, but what does TPE stand for?
Target, probe, educate.
Target, probe, and educate. I actually really like these audits because essentially they're going to get us on the front end and teach us how to do claims. You really only get in trouble if you fail round 1 and then round 2, and then things are not good at all. But for example, what are some previous categories that we've had TPE audits in?
The rehab. So we also have the PAP. The PAP equipments.
PAP.
And the Inco supplies there, I think they did that as well.
Is certain like catheters.
Like catheters. Yep. Or what's good about the TB is that someone will work with you and then they will help you in order for you to pass them. Now, the thing is, if you fail and then fail again, then they'll keep auditing you until it goes to the point where they, the second offense.
Now, the good news is typically with TPE audits, they will tell you ahead of time what product categories are being audited. So make sure, if you don't know what's coming down the pipe in 2024, reach out to us and we'll let you know, hey, these are the categories, they are going to get audited. But it's not like they're not going to choose canes. Canes are never going to be part of TPE audits. It's going to be something that tends to be either abused or an item that Medicare thinks that certain, we might not have the right documentation. So like you've said, PAP supplies have previously been part of audit. Catheters have been part of audits. Braces have been part of TPE audits. It's pretty simple to figure it out. And if you don't get it, and what I like to do is find out what these categories are. And then before the TPE audits even start, I will go over with my team, or you can hire us and we'll do it for you, is we'll go over as kind of your pre-check. We'll look at 10 claims and say, okay, if we were Medicare, we're not, but if we were Medicare, these claims are going to be wonderful. If they're not, that's okay. What we'll do is we're going to start as of today, make sure we have the right chart notes, the right prescriptions. So when the TPE audit does come, and it will, they tell you every year what categories are going to be audited. You don't have to stress about it, because like what happens is, like, for example, our billing company is AccuServe. AccuServe will say, okay, this year's TPE audits on this. And I'll say, okay, not a problem. We've already talked to our offsite team. They've already been getting that documentation and we're ready to go. And so typically it happens and we pass 9 out of 10 or 10 out of 10. But the one we don't get, we then go to the doctor's office and say, I know we had the prescription, but Dr. Smith did not write, that one small thing that Medicare needs to see. And the cool thing about TPE audits, which I love, is once you pass them, you're done. So it's literally one of those things. If you pass it, you're done. They're not going to audit you except for the random audits the rest of the year. Now, if you don't pass, it gets worse and worse and worse. This is not something that you can put off and forget. We've had previous clients that are like, oh, it'll go away. It does not go away until you pass or you go out of business. It's A or B. So yeah, TPE audits. Now let's change the focus to oxygen documentation in the new year. Is that changing at all?
Yes, for oxygen documentation, there is an update on that one. So recently they made an update that we can still use the CR modifier. So that is still possible for the 2024, so long as there is a specific date that they provided on that one. But that's a new update that I have. And there's this one update that we've discussed. Is
it the one about qualifications?
The documentation,
or
yes, the qualifications.
So, because I do know some things have happened in regards of the exact testing criteria, as well as what do you do with kind of those fringe cases such as pneumonia, cluster headaches. There's a lot of that out there.
Right.
So if you are not familiar with this, go to the CMS.gov's website. I'll also ask Mark, who edits our podcast, do us a favor, please link the podcast to that update. So if you are not familiar with it, just click on that and actually read what CMS wrote concerning that, because it's really important. You need to understand what the new laws are regarding oxygen documentation. Did I kind of say that correctly? That's not in my wheelhouse exactly, but I've been in enough meetings where I've heard you guys talking about it.
That is right. So like a cluster headache, before when I was processing an oxygen documentation, it is not part of the diagnosis, which the insurance will approve. But with the recent update, it is now being considered as one of the diagnoses that they allow for the cluster headache, if the patient is going to use the oxygen for a night support, not the continuous one. So only for nocturnal.
And I will say, we also don't know what is going to change in the new year. So we have seen so many times insurances say it's the exact same. It's not. And something changes. So this is all the more reason to communicate with your team. Have people, if you can't do this, hire us. We'll give you 1 or 2 team members to go over the remittances to make sure you are collecting every single dollar that is due to you. I mean, so for example, it's one of those things. And also on a lot of these claims, if they come back denied, some insurances, you only have 3 to 6 months to appeal that claim. So if you don't catch this until April, you have already lost all the income and revenue that is due to you in January. We don't want to go there. And one other thing, this isn't as big, but we've previously done this. I call it kind of the playing the chicken game of claims. Do you know what I talk about when I say, let's play chicken with claims?
I heard you said that before.
Yeah. And essentially, sometimes we know there's deductibles, and typically we will sometimes, we don't do this currently because we collect credit cards and on file. So if it does hit deductibles, but some insurances, they'll actually hold all their claims maybe the first 3 weeks in January. And what essentially they're hoping for is maybe the doctor's offices or the sleep center will file the Medicare Part B claim first. So when you file your claim, it's not going to hit a deductible. That's a very real thing. Like I said, we don't do it because our team does such a good job collecting credit cards on the front end. So if it does hit a deductible, not a big deal. It flips over to patient billing, and then we bill the credit card on file. So that's something that you can do. And I have heard of a lot of other medical supplies doing that. It's really on a case-by-case basis. How are you guys set up? Now, if you tell me you have no credit cards on file, I might actually recommend holding your claims for 2 to 4 weeks. Just hopefully some of those claims will hit, have the doctor's office hit the deductible, because if not, you're going to have to go chase those claims and get paid. Isn't that right?
That is correct.
Okay. Any other things that I can think of that we should warn our, our valued listeners going into 2024, April?
I think having an additional set of people like the offsite team would be very beneficial for the business, since you can work on other things in your company while the offsite team manages the billing side of the company, the billing
and as of right now, we have
documentation.
2 fully trained Brightree trained offsite team members ready to place. Now, granted, I'm recording this on, in December of 2023, but if you call us today, hey, we could place someone into your company on Monday fully trained. But if not, that's totally okay. Once they get placed, we then hire someone else, train them in our company, and they're ready to go on. So they are all ready. Well, hey, also there will be more things in 2024 that we find out when we look at the remittances like a hawk, and as they come up, we'll share them on the podcast. But next week, we're going to change a little bit. We're not going to talk medical supplies next week. We're going to talk finances, personal finances with your offsite team. And it was really interesting. One of the things we do with our US-based team is we offer them it's Dave Ramsey's Financial Peace course. We pay for all of our team members to go through it. That is something and a benefit we offer for our offsite team members as well too. And as we've gone through this, it has been fun. We're going through the classes with our entire offsite team right now, and I have learned, for better and worse, you guys are better than Americans in some areas and worse than Americans in other areas. And we're going to talk about that next week and kind of what that means, aren't we?
Yes, I'm excited for that. Okay.
And in the meantime, go to offsiteteammember.com, reach out to us. And hey, if there's anything you have questions on, we'd love to talk to you about. So hey, take care, and we'll see you next week.